you for standing. You may press star one. Host Jeremy Kahn.
Thank you. Good morning and welcome to this U.S. Food and Drug Administration media briefing on the FDA's final rule to improve access to affordable hearing aids for millions of Americans. I'm Jeremy Kahn with FDA's Office of Media Affairs. In a moment, I'll turn it over to HHS Secretary Xavier Becerra for opening remarks. Following the Secretary, FDA Commissioner Dr. Robert Califf, Dr. Jeff Shuren, the Director of the FDA Center for Devices and Radiological Health, and Brian Deese, the White House Director of the National Economic Council, will also provide brief remarks. After the remarks, we'll move to the question and answer portion of the call. Reporters on the phone will be in a listen-only mode until we open the call up for questions. As a reminder, the audio call is being recorded and live streamed on the FDA's YouTube channel. When asking a question, please state your name and affiliation, and please ensure that the questions pertain to today's announcement and limit yourself to one question and one follow-up so we can get to as many questions as possible. With that, I would now like to welcome Secretary Becerra to our call.
Thank you very much. And let me begin by thanking those of you who joined us. Today, I'd say today's a good day. Actually, I'd say today's a standout day. From day one, when it comes to America's healthcare, President Biden has committed to lower costs for more people with better care. And along with the President signing today of the Inflation Reduction Act, which, by the way, will help us lower drug prices and keep health insurance premiums affordable for millions of Americans, today the FDA opens the door to quality, affordable hearing aids to consumers over the counter. And the operative word here is over the counter. For many Americans who suffer from hearing loss, safe and effective and high-quality hearing aids have been unaffordable. Hearing aids can cost thousands of dollars per pair, and they're not always covered by insurance. I say that not just as the Secretary of Health and Human Services, but as the son of one of those consumers in this country who has had to shop for all sorts of pairs of hearing aids and is still trying to recoup several $100s of unreturned dollars for a hearing aid that did not work. In most cases, patients need to make an appointment before today with a doctor or a hearing specialist to be able to obtain a hearing aid. And that requirement for many people is inconvenient. It discourages them from seeking help. And these are just some of the obstacles to low-cost hearing aid options that individuals in this country should have at their disposal and who need the help to be able to function fully in life. It is tough, and I say this as someone, as I said, a mother who's had a very difficult time with hearing, that it is tough for them to move forward, and it is tough for all of their family members and people they associate with to move forward when hearing is impaired. Reducing the healthcare costs for everyone in America, including those who need help with their hearing, has always been a top priority for this administration. And today's action by the FDA should help make hearing aids not only more accessible, but truly more affordable for those tens of millions of people who've been experiencing mild or moderate hearing. Biden-Harris administration has been committed to ensuring accessible, affordable health care for all. Last year, President Biden issued an executive order on competition that called for the Department of Health and Human Services to take steps to enable hearing aids to be purchased over the counter. The FDA's action today, their announcement, helps move that ball forward. And we believe that this action, which, by the way, I know members of Congress will be happy to hear about because they actually passed legislation back in 2017 that required us to establish a new regulatory category for over-the-counter hearing aids. All of that together is giving Americans better health care for less cost. And that has been a true goal of the president since before he took office. As I said, today is a good day as the President signs the Inflation Reduction Act, but today is also a good day because it further fulfills the President's promise by making sure, through FDA's efforts, that Americans who need help with their hearing aids, and that includes my mom, help is on the way. And so, over-the-counter hearing aids, get ready, folks. You're going to get to save a lot of money, and we're all going to benefit. With that, let me turn it over to our commissioner at the FDA, Dr. Robert Califf.
Thank you, Secretary Becerra. We appreciate you joining us for today's announcement. The final rule the FDA is issuing today establishes a new category of over-the-counter hearing aids. The rule allows hearing aids within this category to be sold directly to consumers in retail stores or online without first undergoing a medical exam or a custom fitting by an audiologist. This landmark rule is designed to help assure the safety and effectiveness of over-the-counter and prescription hearing aids, while increasing competition in the market, improving access to hearing aid technologies for the American public by making them more widely available across the country. Particularly excited about this advance as I received a call from the White House in 2016 during my first term at FDA, asking the FDA to work on this problem. This rule is a result of years of work and engagement with the communities affected and involved with hearing loss. It's nice to see the work come to such a good result. Hearing loss has a profound impact on daily communication, social interaction, and the overall health and quality of life for millions of Americans. I learned even more about this serving on the Lancet Global Commission on Hearing Loss. This is a tremendous worldwide problem where I think American ingenuity can make a huge difference. About 30 million Americans age 18 and older report some trouble with their hearing. This can significantly impact communication with others, personal relationships, school or work performance, and emotional health. There are a number of different causes for hearing loss, including aging, exposure to loud noises, and certain medical conditions or other factors. And despite the high prevalence and public health impact of hearing loss, only about 1/5, 1 out of 5 people who could benefit from a hearing aid are currently using one. Today's action will not only help adults who have perceived mild to moderate hearing loss gain access to more affordable and innovative product options, but we expect that it will unleash the power of American industry to improve the technology in a way that will impact the enormous burden of disability from hearing loss affecting the world. The rule will enable consumers to have greater control over their hearing aid purchasing decisions at stores nationwide or online without a professional hearing test, fitting adjustment, or a prescription. People with hearing impairments, especially older Americans, could see over-the-counter hearing aids available as early as mid-October. In addition, today the FDA has finalized the guidance on hearing aid devices and personal sound amplification products, so-called PSAPs. Hearing aids and PSAPs both amplify sounds for the user and are subject to different regulatory controls. The updated guidance clearly describes the differences between hearing aids and PSAPs and clarifies the regulatory requirements for these products. Together, these actions reflect the FDA's commitment to safely lowering barriers to access, providing consumers with greater choices at lower prices, and helping to facilitate innovation in hearing aid technology. With that, I'd now like to turn to Dr. Jeff Shuren, Director of the Center for Devices and Radiological Health, which has done the lion's share of the work on this issue, to give a few remarks.
Well, thank you, Dr. Califf. The final rule the FDA is announcing today was designed to facilitate easier access to hearing aids and encourage people with hearing loss to seek additional interventions. By creating a new regulatory category of over-the-counter hearing aids, as authorized by Congress, the agency aims to address existing barriers that prevent the use of these devices, including access, social stigma associated with a hearing loss, high cost relative to the perceived value of the devices, as well as certain state and federal regulations. The FDA has worked diligently to draft and finalize these regulations in the midst of its unprecedented efforts to address the COVID-19 pandemic and monkeypox public health emergency. Issuing the rule has been a primary focus for the FDA, and the agency has worked to ensure that the appropriate safeguards are in place to make over-the-counter hearing aids a safe and effective option for consumers. The final rule establishes the new regulatory category for OTC hearing aids and the regulatory requirements that apply to these devices. It also amends the existing rules that apply to hearing aids for consistency with the new over-the-counter category, repeals the conditions for sale for hearing aids, and addresses state regulation of hearing aids. The new over-the-counter category applies to certain air conduction hearing aids intended for adults age 18 and older who have perceived mild to moderate hearing loss. Air conduction hearing aids are worn inside the ear or on the ear with an inside the ear component and amplify sound into the ear canal. Hearing aids for severe hearing loss or for users younger than age 18 will be prescription devices. To assure patient safety as well as effectiveness, the FDA set a maximum amount or output or sound volume limit for over-the-counter hearing aids that's intended to prevent over-amplification of sound to avoid further hearing loss, while at the same time allow for adequate amplification to assure effectiveness of the products. The rule also includes certain device performance and design requirements, such as limits on distortion, noise, delay, and the range of frequencies that the device can reproduce. In addition, the rule includes a requirement to limit the insertion depth of the device, how far the hearing aid can go into the ear canal, to minimize the risk of injury. Furthermore, today's announcement specifies labeling requirements for over-the-counter hearing aids to assure consumers have the information they need to make an informed decision and use these devices safely, including minimum user age limits, how to report adverse events, warnings, and conditions or symptoms of hearing loss that should prompt a consultation with a hearing healthcare provider. The finalized guidance for hearing aid devices and personal sound amplification products, or PSAPs, describes what these products are and outlines the regulatory requirements for each. PSAPs are intended for people with normal hearing to amplify sounds in certain environments, such as for recreational activities. While hearing aids and PSAPs both amplify sound for the user, PSAPs are not intended to aid persons with or compensate for impaired hearing. It's our belief that these two actions will help encourage additional innovation in the field of hearing aid technology. Consumers will soon be able to purchase over-the-counter hearing aids from a wider variety of retailers as more options for hearing aid models are available to them at potentially lower costs. By improving access to safe, effective, and potentially more affordable over-the-counter hearing aid options, millions of Americans will now have an opportunity to improve their hearing health. With that, I'll say thank you, and I'll turn it over to Brian Deese, White House Director of the National Economic Council, for a few remarks.
Thank you, Dr. Shuren, and thank you all for joining us today. As Secretary Becerra noted, this action is part of an important, broader effort by the President and his entire economic team to promote competition in the American economy. And it stems from the landmark executive order the President issued a year ago last month that identified 72 actions across the entire government that would, in practical terms, increase competition, which we know, if done right, has the benefit of both increasing options and lowering costs for consumers. There's perhaps no better example of this than the rule that the FDA is finalizing today. I just want to say a little bit about how the competition problem in this area. The issue here was that the requirement to see a doctor or a hearing specialist was an example of what economists call a barrier to entry. It was a regulation that kept more companies or more innovators from entering the market to compete. And that not only limited who could enter the market and get distribution, but the bundling of hearing aids with exams also reduced competition by making it harder for consumers to comparison shop for the best deal, which eroded the competitive pressure to charge less. In short, the requirement to see a specialist was not only a burden and an annoyance for many consumers, but it actually created a competitive barrier to entry. I think in sum, this is an example of where a regulation itself was getting in the way of innovation and consumer choice. And with this action, the FDA is now lifting that regulatory barrier and streamlining this process in a way so that now adults with mild to moderate hearing loss can safely walk into a drugstore, get a hearing aid over the counter without an exam or a prescription. That action will unleash significant competition in the market. And we expect that competition will drive down costs. In fact, the FDA estimates this rule will save consumers on the order of about $1,400 per individual hearing aid, or over $2,800 per pair. And that's the direct savings that is the potential that comes from this rule. But we also expect this rule to unleash new innovation, which ultimately will mean better quality products at lower prices in ways that we cannot even estimate or model today. So as all of our speakers have said, this is going to make a real and concrete difference in the lives of tens of millions of Americans. I would add to Secretary Becerra's point, certainly, I would add my mom in that category of people who this will provide some comfort and some support to, and make people's lives a little bit more convenient, and is consistent with this broader approach that President Biden brings to economic policy, which is that more competitive markets generate better outcomes for consumers, and that we can, by being smart, reduce some regulations that actually unlock competition. The last thing I will say is that this is something that there has been significant and serious bipartisan work in Congress on for many years, including the legislation that passed in 2017 to authorize this change. And after the last administration did not actually prioritize making this a reality, the President's executive order on competition identified this as a priority, set a clear deadline, made it a top priority, and I'm tremendously proud that now, thanks to the leadership of HHS and FDA, we are now in a situation where as soon as mid-October, Americans will begin to be able to purchase more affordable hearing aids over the counter in their communities. So with that, I'll turn it back to the moderator, and we can move to the question and answer portion.
Thank you, Director Deese, and thanks also to Secretary Becerra, Dr. Califf, and Dr. Shuren. At this time, we will begin the question and answer portion of the briefing. As a reminder, the call is being recorded. When asking a question, please state your name and affiliation. Also, please ensure the questions pertain to today's announcement, and we'll limit to one question and one follow-up so we can get to as many questions as possible. With that, I'll turn it over to the operator.
David Lim from Politico, your line is.
Hi, thanks for taking my question. I wanted to ask about states that have lobbied for the ability to augment federal regulations on OTC hearing aids. In January, the National Association of Attorneys General argued that states need to have a regulatory in this space to protect consumers. The final rule says that FDA will consider the impact on public health if a preemption exemption is granted. My question is, if states try to place additional limitations on output levels in the name of safety, will such requests be granted, or will they be denied because FDA believes that the levels that are proposed in this final rule are appropriate?
This is Rob Califf. I'll start, and I'm sure Dr. Shuren will have, because he spent a lot of time on this issue, which I can tell from your question, you know that there was when the preliminary rule was put out, there were a lot of comments. Many of them were oriented towards this particular issue of the output limits. I mean, my general view would be that after a lot of consideration from all parties, we thought we hit the sweet spot on the output limit. The concern being that if the output limit is too high, then it can impair hearing over time. If it's too low, then the hearing aid is not very useful. If states want to do something different, I think it would probably be a case-by-case issue, but I'll let Dr. Shuren comment on that.
It would be a case-by-case issue. However, as Dr. Califf raised, we believe where we have set the parameters best balances safety and effectiveness, and we would not look to have changes that will result in technology that would be less effective for consumers.
Trying to get the operators.
On the other hand, states do have the opportunities to enforce consumer protections for over-the-counter hearing aids, and that includes requirements for providing reasonable warranty or return periods for hearing aids that generally are going to promote rather than strict or interfere with commercial activity. Also, in terms of state requirements to provide disclosures on terms of sale. So there's a lot of other protections that states, if interested, have the opportunities to put in and would not anticipate preemption. But the law was very clear also that to preempt any kinds of state requirements that restrict or interfere with commercial activity involving over-the-counter hearing aids, and of course restricting performance would impact those opportunities for innovation and competition.
As a reminder,
Thank you, operator. We'll take the next question, please.
As a reminder, if you would like to.
Yeah, hi. Thanks for taking my question. I guess this was for Brian Cleese. You talked a little bit about what the numbers would come down by. I was just wondering where they're starting from. You said that it would come down by $2,800 per pair. Where are we? What is the starting point for that? Is that around $5,000 per pair?
Well, again, I'll
Go ahead, Rob. You go ahead. You go first.
Just a quick overview. Of course, this is an estimate, and based on a lot of data. It's interesting you pick $5,000 a pair. That's what I learned my mother-in-law paid for her hearing aid. So that strikes a resonant chord with me. I'll turn it over to Dr. Shuren.
Thank you.
Oh, well, certainly, as Dr. Califf noted, they're estimates, and those estimates are about what the amount of reduction that could occur. Those amounts will vary. A lot of it is just hard to predict and important to see what happens in the marketplace. But we do know with competition, we do see reduction, can see reduction in costs, and certainly removing the added costs of having to access the healthcare system to see a healthcare professional eliminates that cost as well. Brian, I don't know if you had more to add.
No, I think that covers it.
Thank you.
Thank you, operator. We'll take the next question.
Austin Landis with Spectrum News, your line is open.
Hi, everyone. I was wondering if you could just elaborate on the timeline a bit. I remember back when you announced the proposed rule in October, you guys had said maybe spring or late summer that these would be available, and now mid-October. So just wondering what's happening in these months that it moved.
Again, I think we'll continue the referring to Dr. Shuren after just a more general comment. I mean, as you know, as we said, there were a lot of comments that had to be adjudicated. People felt strongly about several of the issues that needed to be dealt with. So it just took a lot of work to make sure that we had responded to all the comments and found what we thought was a sweet spot. And then going forward, this rule informs the manufacturers what they need to do to put OTC on the market. Remember that the origin of the regulations that we've just deconvoluted, as Brian Deese said, there were manufacturers selling bogus hearing aids to people in the 1970s, and that led to perhaps an overreach in terms of the amount of requirements that were put into place. So we want to make sure that the OTC hearing aids are of good quality, and it'll take a couple of months for the manufacturers to make sure they meet those specs. Dr. Shuren?
And just to add, today, of course, the regulation is being issued. It goes into effect in 60 days. So at that point, a manufacturer who has a product that meets the requirements and specifications for an over-the-counter hearing aid can begin to market at that time. But ultimately, it will be up to the manufacturers. We do know of manufacturers who have been anticipating the final regulation and preparing accordingly to begin to introduce product into the marketplace. But it can occur as early as 60 days from now.
And this is Brian. The only thing that I would add to Dr. Shuren's point is this is why competition is so important. That at that point, manufacturers can initiate the process, but given the opportunity to sell into this new market, that's a very attractive proposition, and it turns the competitive dynamic in this industry on its head, and we believe, based on lots of analysis and also other market dynamics, that will create a quite powerful and positive virtuous cycle for consumers.
Great, thank you all. Operator, we will take the next question.
If you would like to ask a question, please. David Lim with Politico, your line is open.
I didn't think I would get another one. I wanted to ask about the cost savings estimates in the final rule. So it says, I believe it's annualized $63 million over the next 10 years. Given the consolidation in the hearing aid industry right now, and kind of where sales are, do you have any estimate as to how quickly the market will realize those savings? I know that you're saying October, but the final rule also lays out, this timeline of, I believe it's 240 days to comply with new requirements for manufacturers already on the market. Could you talk a little bit about, what timeline you actually expect for the majority of the market to move towards this, especially the big manufacturers?
I'll turn now to Dr. Shuren. I know that his team has spent so much time on this. I would just say it's always unpredictable when competition sets in. It could be sometimes things really accelerate. But Jeff, what are you expecting?
Again, it is hard to predict, and so what we do know is you've got also traditional hearing aid manufacturers in this space, and ones who will go ahead to have product that's over the counter, but we're also anticipating manufacturers who are not making hearing aids today entering into this space, and that also will drive the marketplace, but very hard to predict exactly what we'll see when.
Great, thank you. Operator, I believe we have time for one more question.
Grace Frieden with MedPage Today, your line is open.
Yeah, hi. Thanks for taking my question. You've been mentioning that you want to make sure the hearing aids are safe and effective. I know there's been a lot of concern in the audiology community about people buying hearing aids without getting their hearing tested and having a full evaluation. So I just wanted to get your comments on what's being done to ensure that people get the hearing aid that works best for them.
Again, I'll start out. I did, as I mentioned before my nomination, I was helping the Lancet Global Commission on Hearing Loss and heard from all the experts around the world. I think the advantage of the consumer approach is people can try things out and it will drive prices down and also stimulate technology. And also in my previous job, I had a chance to see what technology can do, and I think it's a vast expanse of possibilities out there for what technology could do to produce better hearing aids at a lower cost. But it's also the case that there are cognitive changes that happen with hearing loss that are complex, and social situations of hearing loss are complex. I might even mention my wife has said I might be one of the first customers for over-the-counter hearing aids. And so there is going to be the option for people to go into the prescription space, see an audiologist. We have a shortage of audiologists. I think we'll be plenty busy with people who try the consumer approach and find that they need additional help or may have medical problems that dictate that they're under the care of a physician as they work with their hearing aids. So none of those options are taken away. This just opens up that consumer option for people that have a relatively simple hearing loss problem that can be helped by the over-the-counter product. I know you guys spent a lot of time on this too because it was a medical assistance that was so much at the core of the previous regulation.
Great. Thank you, everyone. So this concludes today's media briefing. A replay will be available on the FDA's YouTube page, and the FDA press release has also been posted on the agency's website. If you do have follow-up questions, please contact the FDA press office at fdaoma@fda.hhs.gov. Thank you very much and have a great day.